In this lecture, I will be discussing an overview of strategic couple therapy, including assumptions, function or dysfunction, the role of the therapist, the process of therapy, and interventions and techniques. A strategic couple therapist assumes that problems persist as a function of people's well-intentioned efforts to solve them. By viewing clients through this strength-based lens, that they are in fact trying to solve their problems but have gotten stuck doing so ineffectively, we can be more empathic with our clients. This reduces the risk that we raise our client resistance by our own resistance. So if you're viewing a client as malicious or manipulative or somehow malintentioned, you may have negative feelings towards that client and behave unconsciously in ways that actually increase the client's resistance. So if you can view the client's problems as well-intentioned, then it makes you better able and better positioned as a therapist to intervene. Our goal, we assume that if we interrupt the client's efforts at solving the problem in this way that's no longer working, that is then the solution to their problem. Of course, in order to do that, we need to identify the sequence of behaviors that is maintaining the problem, because this sequence contains the attempted solutions to the problem. A strategic therapist also assumes uniqueness, that what works for one couple may not work for another. So there are no prescribed preferred solutions to any problem. A therapist has to work with each client to figure out what that client wants to do differently. The strategic model is just that, a model. It's not a theory that attempts to account for relational problems. It's a model for helping people to solve their relational problems. So because of that, there are no assumptions made about normal or healthy couples' behaviors or interactions. If something is working for a couple, then it's working and we don't fix it. If something is a problem because it's attached to a problem the client has identified, then we can try to fix it. So that leads us to the concept of the complaint. Something is a problem if the client says it is. So as a therapist, your job is to identify a specific complaint that the client has, something that they would like to be different. The undesirable behavior, so typically whatever the complaint is maintained in a positive feedback loop. So that is, whatever the problem is, there's an attempted solution, and that solution, ironically, maintains the problem. Attempted solutions could be acts of commission or omission. So commission are more visible pursuit behaviors. So fusion, enmeshment, demanding, accusing, criticizing, things that we would think of as more active behaviors. Whereas omission are more passive behaviors, withdrawing, denying, defending, etc. So the role of the therapist is to persuade at least one partner to do less of the same. And you do this through 4 different roles or mechanisms. The first is customership. So you want to identify which, if either or both of the partners are customers for change. This is typically the person who is most invested in change, most concerned about the problem, or if you only have one person showing up, then it's that person. The reason for this is that if, say, you have 2 partners and one person is more of a pursuer and is more concerned with the problem, if you focus on the partner that's already withdrawing to act, you're actually only asking for more of the same. So you're doing exactly what the demand partner is doing by demanding the withdrawal partner to act. And so that's only going to elicit more withdrawal behavior. A therapist also wants to maintain maneuverability. So this is about maintaining control of therapy using a wide range of directives, from subtle to explicit. So you're constantly providing feedback and guidance to the clients in a variety of ways. Now, a subtle directive might be if a client suggests an idea and you say, "That sounds like a great idea," or just smile and nod your head. It's subtle, but it's directive because it's sending a message to the client. A directive could also be explicit, whereby you tell a client exactly what they want to do, exactly what you would like them to do, for example, for a homework assignment. Strategic therapists don't presume to know what will fix the problem because they don't. So taking a one-down position is natural and necessary and helps to explore possible solutions by being curious, being empathic, by not presenting your interventions or your homework assignments as the solution, because of course that will also elicit resistance. Empathy is important to view clients through a strength-based lens in order to reduce resistance. It's also important to help identify their unique solutions by adopting their language and adopting their framework and exploring different possibilities with them. So in order to assess for a problem and to find potential solutions, a strategic therapist needs to define a resolvable complaint. So this has to be something specific that the client can point to and say, this is a problem. And it needs to be specific because you need to identify the problem-solution loops that maintain the complaint. So in the case study in our textbook, the therapist asked Maria to describe a specific incident where Maria, quote, brought out the worst in Harold. And the therapist did this by asking questions such as, how did the issue come up? Who says or does what? Then what happens? And by asking all of these probing and clarifying questions, the therapist was able to identify a problem-solution loop in which Harold would ask for reassurance from Maria. Maria would try to reassure him, but Harold would only then ask for more reassurance. And this cycle typically escalated. And now when you are identifying the problem-solution loop and suggesting different solutions, it's important to understand the client's language and their view of the problem and the relationship. And you use that frame to deliver possible interventions or solutions. So when giving Maria homework at the end of the first session, the therapist had Maria ask Harold if he would be willing to help her in understanding her contributions to the problems in their relationship. This fit with both Maria and Harold's view that the problem was Maria's and not Harold's, and that Harold was in fact the more mature partner or the more capable partner. So it fit with their view of the problem in their relationship that Maria would ask Harold for help with her problem. It's very important in strategic couple therapy, perhaps more than others, to find minimum or mediating goals. You need to find a small, concrete, achievable goal that you can then work towards with the client. When you set smaller goals, it makes it much easier to see progress. And then any progress feeds into the positive feedback loop for less of the same. So for example, in the case study, Maria's original goal when she called was to understand her contribution to the demise of her relationships with men. In session, she repeated a similar goal, but emphasized that she wanted to do this so as not to ruin her relationship with Harold. Now that's a very big, broad goal, and it would be very difficult to determine if progress was being made towards Maria understanding how she ruins relationships. It's very abstract, and it's very big. So instead, the therapist worked with her to define a minimum goal by asking, what will let you know that you and Harold are getting a handle on this jealousy problem? So by asking clarifying and probing questions, the therapist and Maria were able to identify that she'd know things were getting better when they were not having arguments about sexual issues. She would take that as a very good sign. So this is a good minimum or mediating goal because it's very easy to identify whether arguments are or are not happening. And if they're not happening, then that's perceived as progress towards reaching the goal, which feeds into a feedback loop of more progress. There are a few other therapist roles or general techniques with strategic couples therapy. And one is called the patient position, which we've already discussed. And this is about speaking the client's language, using their view and their frame to set the stage for interventions. So the therapist framed their intervention for Maria to meditate when Harold started arguments. They framed that in line with Maria's frame that she needed to do more self-reflection to understand how she ruined relationships. So this way, asking Maria to interrupt the sequence, which is the therapist's goal, was seen as aligning with Maria's goal to do more self-reflection. Therapeutic restraint's another technique used in strategic couple therapy, which could look like encouraging clients to go slow. that improving too fast is risky and shouldn't be done, and possibly even letting them know how they could make things worse. The assumption behind this is that clients are more likely to cooperate with suggestions that are not pushed too much, and this can relax their anxiety about solving the problem too fast. So Maria's therapist got her buy-in by suggesting that even small steps and small changes might be too burdensome for her. But because Maria felt such a large sense of responsibility for the problems in her relationship with Harold, she felt motivated to take on these burdens. And so had the therapist prescribed her meditating as the solution to their problems, Maria might have been much more skeptical. Another technique is performing the problem. So this is diagnostic. This is asking the clients to actually do the things that they say keep happening that are the problems. So what this does is demonstrates that the clients do have control over the behaviors in this problem solution loop, because if they can choose to do them, theoretically they can choose not to do them. And this also opens up the possibility that there could be a change in the problem solution loop. For example, if one partner decides to perform the problem and another partner decides not to, that introduces a new behavior where they can choose not to participate in the loop. But because the therapists in the case study did not have Harold's customership or participation, and because Harold typically initiated the jealousy incidents, performing the problem was not a very good choice in this case. It might not have worked for this client. The therapist also considered having Maria jam communication with Harold by agreeing when he accused her of not being attracted to him or of being more attracted to her exes, but decided that that was too risky, probably for a variety of reasons. One, they don't know Harold. They knew that he had a temper when he felt insecure, and I also think there were multiple power discrepancies in the relationship between Harold and Maria that could put Maria at risk. First, Harold was a professor and Maria was a graduate student. Harold's male and Maria is female. And Harold, at least I read Harold as being white or European American, and Maria was at least part Latina. This next slide, although the images are not fully there, shows several common complementary patterns that you might see maintaining a problem. So demanding and withdrawing, criticizing and defending, accusing and denying. So of course on one side we have the commission behavior, the more active behavior, demand, criticize, accuse. And on another side we have the omission behavior, the more passive, withdraw, defend, and deny. So typically you want to look for the customer, who is very often the person engaging in the commission behavior, and asking them to do less of the same. So you'd be attempting to find solutions where the demanding partner would not demand, where the criticizing partner would not criticize, or the accusing partner would not accuse. Now again, that's more of a go-to and not necessarily the rule, because as we see in the case study with Harold and Maria, Harold was the commission partner by accusing Maria, but Maria was the only customer. So they had to find a different way to interrupt and jam that cycle. Now, when you don't have complementary patterns, but you have a symmetrical pattern, such as couples that engage in high conflict and just escalate one for one, you can basically get one partner to take the one down. So by examining the couple's unique context, by examining different possibilities for behaviors, strengths, resources, you can elicit customership from at least one partner to take the one down or not participate in the conflict. The other thing you could do is to ask the couple to perform the problem in unsuitable or awkward conditions. So a famous example is a couple that always fights, asking them to fight standing in the bathtub. The idea behind this is that it is absurd and they won't want to go stand in the bathtub, and then they will actually be able to choose not to fight. With self-referential complaints, that means symptoms that aren't easily identified as being maintained by a relationship. So things we think of as individual complaints, sexual dysfunction, substance use, depression. These things are, as we assume, maintained by the couple's interaction. But there's also an individual component whereby the symptoms are maintained by each individual person as well. So the goal here is to interrupt both the cycle within a person and the cycle between the two partners. And there's a great example of this in your book about sexual dysfunction. So strategic therapy works well for couples with a clear complaint and at least one customer for change. But it can work with resistant clients as well, particularly if you incorporate some solution-focused language. Clients do need to want things to change. They don't have to want to change themselves. They just have to want the situation to change. And then by examining different preferred solutions, the therapist can help the client find ways to change. It's not a good model for clients who don't have a specific complaint. For example, if they just want to improve the relationship in a general way or grow personally. Now remember, Maria first came with a general goal like that, where she just wanted to understand how she contributed to the ends of her relationships. But by working with the therapist in the first session, they were able to identify a specific complaint that existed in her current relationship. The risk with a model like strategic therapy is that by only addressing the problem or the complaint that clients bring in, you run the risk of ignoring more hidden problems like substance abuse or violence that clients may only bring up in sessions where you're exploring more of the background and exploring more outside of the problem that they're bringing in. So that is a risk with this model. And having good paperwork at your practice or your agency that screens for these types of behaviors is one way to circumvent that risk. In class, we will briefly review the case study of Christina and Owen together, and we'll be looking at identifying what their complaint might be, identifying what a minimum goal might be, hypothesizing as to their problem solution loop, and then discussing whether or not they might be good candidates for strategic therapy and how a strategic therapist might work with them. So feel free to brainstorm on some of those ideas before we meet.